are real common. And when we see them happen, like during pregnancy, women get nauseated. So yeah, now not everybody gets nauseated, but it's actually kind of good news. If we looked at Carrie and we told you instead of having surgery last week that she had quit smoking and she felt crummy and poor and things like that, you wouldn't be too surprised. If we said she had quit using crack cocaine, right? You know, in other words, you just don't feel well. You're not all dressed up. You don't feel great. You just feel sick. And that makes sense with a sudden withdrawal of a chemical or a drug like estrogen. And estrogen is tremendously powerful. Just think of a few things. Think of women and their monthly cycle. Now not everyone has this, but it can be a real emotional up or down during that monthly cycle. Of course, all the premenstrual tension and anxiety and depression and things. Think of depression after the delivery of a child, postpartum depression. How does that make any sense when you've had this miracle occur in your life? How can you be sad about that? Well, you can be sad because it's not the situation, it's a chemical effect in the brain. So it's not a bad or a weak person, it's a chemical change. Or think of a woman going through menopause. Most people don't find that a joyful, fun experience. And if you think about that, again, it's a drop in estrogen. And again, it's hard to see this as a positive, but this is a tremendous positive because what we're seeing is a drop in estrogen. Estrogen causes blood clots. Estrogen causes cancer of the breast. Estrogen, and cause may not be exactly the right word, but high estrogen means high risk of breast cancer. High estrogen means high blood clots. High estrogen means high endometrial cancer. So it's terrible to go through this drop in estrogen, but if it was high before, what we may be seeing, we may be on the threshold of changing somebody's risk of cancer. So if you have a few bad days and you're nauseated, that's terrible and we're disappointed, it's a complication of surgery, but there's this tremendous benefit we're expecting, that we're hoping for, that we're counting on. That maybe Carrie is not going to be someone who dies of a blood clot. And we know that happens. We know that happens because we just lost a pre-op patient whose husband, reported to me, gee, she's not coming for surgery. And each of you who are heavy sitting here, unfortunately, with that high estrogen, face that same kind of elevated risk. And so, again, it's awful to have a week of nausea, but in return for maybe avoiding a breast cancer.
I'm starting to understand the my body cries for more estrogen. I produce it. That makes me fatter. That causes me to need more estrogen.
That vicious cycle we talked about, right? Right.
So my question is, if many of us obese women have that chemical thing going on, what's the deal with obese men? Why? Was there a chemical thing that goes on with them? Is there?
I feel answering this question can only get me in trouble.
Oh.
But basically, the estrogen is a profoundly powerful chemical in the brain of women, and it's at high levels at some points and sometimes low levels. And for whatever reason God intended, it goes up and down, and when it does, some women have a marked increase or decrease in their emotions. Now, men don't have that same cycle. Now, men have lots of other issues, but they don't have that cycle. Men are the ones who cause car crashes. Men are the ones who rob banks. Men are the ones. Women don't do those things.
Not so much.
Except for the Barbie bandits, I guess. But basically, men and women are different, and that estrogen cycle is totally different in women than it is in men. Men have testosterone, they don't have the monthly cycle, and post-operatively, our patients who are men generally don't have depression, don't need extra estrogen or testosterone support. Their testosterone levels usually goes up